The maltreatment of children with disabilities and solutions to this problem. Current data on incidence and prevalence of maltreatment in children and disabilities are limited by varying definitions of disability and lack of uniform methods of classifying maltreatment. The U.S. Children's Bureau reported that an estimated 678,000 children were determined to be victims of abuse or neglect in 2018. Based on national data from 2015, child victims with disability accounted for 14.1% of all victims of abuse and neglect. Child abuse and neglect is reported in 3% to 10% of the population with disabilities. Child maltreatment may result in the development of disabilities, which in turn can precipitate further abuse. The causes of abuse and neglect of children with disabilities are the same for all children. Several elements that may increase the risk of abuse for children with disabilities are chronic illnesses or disabilities. These can place a higher emotional, physical, economic, and social demand on the families. The stress of the finances with raising a child with disabilities is often high, and it contributes significantly to the family stress level. Studies have found that families have more out-of-pocket costs for health care. Another cause of child maltreatment could be a substance disorder with the mother. One example is fetal alcohol spectrum disorder. The children with FASD often have learning problems and speech and language issues and are typically impulsive, lack focus, and have poor judgment. This disorder can be very frustrating to the caregiver and parents with an ongoing substance use disorder may not be able to handle the children's challenging behaviors and give more discipline to their children. Some parents of a child with disability overestimate their child's capabilities. Unrealistic expectations are also associated with decreased degree of empathetic awareness of the child's limitations. Parents of children with intellectual or communication problems may turn to inappropriate physical punishment due to frustration of what they perceive as stubbornness or intentional failure to respond to verbal guidance. Inappropriate expectations and ignorance of challenges a child with a disability might face can be linked to a higher risk of maltreatment. The use of aversive procedures and restraints for children with disabilities has fortunately been diminishing. This is in part to state legislative changes. These practices are still sometimes in use in homes, schools, programs, nursing homes, group homes, and other institutions. State laws are often unclear, contradictory, and varied regarding aversive and restraint techniques do not always consider this technique maltreatment. With abuse and neglect, children with a disability are 3.79 times more likely to be physically abused than those without a disability. Harsh discipline, whether physical or verbal, can be negatively affect children emotionally. The highest rates of physical abuse are with children with mild cognitive disabilities and no motor disability. Children younger than 2 years with a cleft lip and palate, Down syndrome, and spina bifida have the same rate of overall maltreatment as their typical developing peers. However, the risk of medical neglect was significantly greater among all three birth defects than their peers. The global abuse and neglect, which is not just, it's a global issue. Abuse and neglect is a global issue. Children with disabilities experience a high burden of all forms of violence, despite advances of awareness and policy in the past 10 years. Pediatrician's role. Pediatricians and other healthcare providers need to be actively involved in the prevention, identification, and assessment of possible maltreatment of children with disabilities. They need to recognize that these children are at higher risk for maltreatment. Pediatricians and other care providers play a key role in evaluating and documenting medical conditions that may or may not predispose children with disabilities to injury. Healthcare providers can document abnormal physical examination findings, observed behaviors, and reported behaviors to establish the problem list for children with disabilities. Preventive strategies. Some of the ones I found were the parent training programs to increase the knowledge and understanding on the child development, giving information of the specific disability and the real expectations in the development. You have parent training programs to consolidate skills to the correct child breeding and develop positive skills to bear the disability. Measures to reduce the emotional stress. Measures to improve isolation, particularly in families who live in distant rural areas. Measures to improve the knowledge and to make easy the access to early attention, healthy, legal, educational, leisure time, and vocational training resources and services of the community. Information and training programs can be prudent, improper, or illicit use on the prudent, improper, or illicit use of medicines and therapeutic substances and rehabilitation therapies for children with disabilities. Extensive home-based support, including assistance with daily household tasks, respite care programs and services to keep the caregiver from getting burned out syndrome, home visitation programs by trained professionals, and parent-to-parent support programs. In conclusion, children with disabilities are abused and neglected. This can be stopped by getting the parents and caregivers the proper education and resources to help take care of these children. No one should be abused and neglected, but just especially the ones that have no voice or have a hard time getting their voice out shouldn't be. Thank you.